Hello, everyone. I'm Krista Blow, and this presentation is Wombs Waging War, a Silent Battle. This is going to be an overview on the impact of uterine fibroids on women's health and the need for better education and holistic treatment options. So let's get into this. So, uterine fibroids is a cluster of tumors in the uterus that can Hi everyone, I'm Krista Blow, and this is my presentation on Wombs Waging War, a Silent Battle. This is going to be an overview on the impact of uterine fibroids on women's health and the need for better education and holistic treatment options. So let's get into this. So, what are uterine fibroids? Uterine fibroids are tumors in the uterus. They have a high prevalence of disabling consequences. What does this mean? It can cause a lot of pain for women in their wombs and cause a lot of discomfort with their everyday activities. Again, it's a growth of benign tumors, and they typically are not cancerous in very rare cases where they reported to be cancerous. And really, it's an invisible war inside the bodies of millions of women because it's not really a condition that's talked about, although many women suffer with it. And because of its silence, there is a lack of information and treatment options that are very viable. So, how does this affect me? You see me and my mom there. That's me on the left, and that's her on the right. I have a personal journey and connection to this because my mom suffered with uterine fibroids when I was growing up. And this motivated me to find a healthier and more effective approach to dealing with the issue. She suffered for a long time and inevitably had to have a hysterectomy, which is a complete removal of the uterus. So while she was dealing with it before the surgery, she suffered with anemia from excessive blood loss. And I did watch her make some changes that did help her with the symptoms, including dietary and lifestyle, but inevitably, I actually did get fibroids, even though I, along with her, incorporated those changes into my life, and that was much later on. But I did have a lot of personal success with an integrative approach, which I'm going to talk about later. And I did not suffer as much as my mom did. So, from one generation to the next, there was some improvement because of the education she provided me. And I want to do that for more women. So, specifically, African American women are the main group who suffer with fibroids the most. Specifically, they're 3 times more likely than women of other races to develop fibroids. They're 2 times more likely to undergo a hysterectomy. And they're more likely to get uterine fibroids earlier in life and develop symptoms. And those debilitating symptoms impact everything from anemia was one thing I mentioned, which makes you lethargic. It also affects your ability to keep stable employment for many women. And it can also cause intimacy issues in relationships. And so, despite the prevalence of uterine fibroids in Black women only make up 15% of study participants in uterine fibroid research studies. So, that's important to note because although they're affected the most, they don't make up the largest amount of participants in studies. So that brings me to some of the socioeconomic factors. Um, there is a possible genetic predisposition that is believable from my own personal experience, as I have them, and so did my mom. Um, and low income environments and limited healthcare access does affect not only the diagnosis of the fibroids, but the treatment. So many women don't know they have them until the symptoms are already bad and they've had those fibroids for a while. And then there's lack of thorough interest in studies, which I did touch on already. And there is a role of environmental factors. So typically, the low income neighborhoods are situated in environments which have already proven to have hazardous effects on other aspects of the lives of those in the community. But in addition, there really aren't that many studies on fibroids and that connecting the environmental hazards. So it's quite possible that the role of environmental factors is exacerbating the uterine fibroid condition in the Black community, as it is with many other things. And then there's specifically disparities in research, which again I did touch on. But there really needs to be a focus on the importance of alternative and preventative treatments. So we want to stop the occurrence of it in such a great number, or at least address the risk so that we can provide more education. And the need for addressing the healthcare disparities, again, being able to be more than 15% of participants in research, since Black women make up the largest population who have the condition, and also accelerated research and improved access. So we need more research being done and access to those in those lower income neighborhoods who otherwise would be able to access it. And also empowering women to manage their condition. So that's with the education and knowing how to address things from a holistic approach, which I'm going to get into. So I've developed a comprehensive intervention for uterine fibroids in African American women within my project. That includes dietary modification. This was something that I focused on as a result of watching my mom focus. There's going to be a focus on anti inflammatory dishes and a reduction of processed foods. Inflammation as a predictor of fibroid growth. The studies have shown a correlation between inflammation, high inflammation, and obesity. And then three, instructions on dietary changes from personal experience. Yes, I have done this personally by limiting the amount of dairy consumption and also addressing the sourcing of the meat products that I consume. So the eggs, ensuring that they're cage free, and then if I do have any dairy products, it would be from cows not treated with RSBT, which is a type of hormone, because the imbalance of hormones has been also linked to uterine fibroid tumors. So that is something I did when I shrank my tumors, and that is part of the wellness programs that I've already worked on informally with women, but I will be progressing those, and I'll talk about that in this project. There's also an environmental component specifically related to hair relaxers. I did stop relaxing my hair shortly after my mom's diagnosis. There was some very limited talk about the correlation. That's one of the reasons why I just did decide to stop relaxing my hair. I didn't have fibroids at that time, but knowing that it's just not good overall for your health, and the exposures to endocrine disrupting chemicals. And early exposure doesn't increase your risk for fibroids. So there are little girls in the Black community who do have their hair relaxed, and many in the community are just do not know about this. So there needs to be awareness so we can create those preventive measures. Another option that I have done and I still do to this day is red light therapy. I have designed as part of my project a quasi experimental component to assess effectiveness of red light therapy, and my intention is to implement that with Black women. There is a potential benefit of red light therapy in fibroid management because of its ability to regulate hormones. And again, I have had personal experience with this. I do this on a regular basis. It also has aesthetic benefits from smoother skin to increased energy, better sleep. There's so many benefits to red light therapy just in general. And then mindfulness practices. A mindfulness practice of choice is excellent at regulating hormones because of the ability to, for one, to go within and to access their peaceful place. And doing this on a daily basis has been shown to have an effect on health outcomes by reduction of stress. And so I have developed several integrated approaches with mindfulness included. In order to enact these changes, this is how I designed my project between the awareness about hair relaxers, the dietary changes, the red light therapy, and mindfulness. I've started a collaboration with the Transport Workers Union, which is through my employer, and many of the women a part of the union are African American. So I plan on sourcing women there for the study with red light therapy. I also am developing a book, which is almost finished being written. It's called Shrink, and it's on the specific dietary and lifestyle changes related to shrinking uterine fibroids and weight loss. And again, I said I informally treated women, but I'm developing a full online wellness coaching program which will address these issues. And just in general, creating a community of support for women so that if they're suffering with uterine fibroids, they can have some resources and access to an education and network for increased autonomy, relief of symptoms, and support. This is specifically the coaching program that I spoke of. It's a combination of one on one group support and educational resources. And it's building upon um, previous work that I've done, and I've worked with women who've had uterine fibroids that have successfully shrank them, as I did. And it's also about maintenance. How do you prevent it from going forward, and customizing a plan for each person so that they can deal with the symptoms and move forward? And of course, preventive education, passing down the knowledge to future generations and intervening early to prevent fibroids, as my mom passed down the education to me. And unfortunately, I couldn't prevent it, but my experience was significantly less debilitating than hers, and I have not had to have a hysterectomy, and I do not foresee having to do so. This is an actual red light bed at Next Level Therapeutics, which is here in Manhattan. Uh, I have teamed up with them. They've already agreed to help me with the study on red light therapy with African American women from the Transport Workers Union. So, this is a great feat to begin this process. It will be quasi experimental, which is a beginning stage, and hopefully can grow into larger clinical trials at a later stage. But I am happy to be able to begin the process there with the medical doctors on site. And the future of my project, I hope to reflect in narrative and nutraceutical empowerment. Specifically, this is women being able to express their experiences through documenting it in a narration. And nutraceutical empowerment is about making specific changes, lifestyle changes that can be integrated, not just for the purposes of healing, but incorporating it for your overall well being, which is the goal. So, managing the symptoms from uterine fibroids, addressing diet, estrogen, environment, and the psyche, and just a patient narrative mapped onto a scientific narrative is actually documenting it so that we can keep records for future generations and studies to come. So I want to thank you so much for your time and your attention to this matter, and I hope that you all fare well for now.